Knock knock. Hi there, my name is Josh. I'm a student nurse practitioner from Saginaw Valley State University. Could I have your first and last name?
Wesley Bishop.
Hi, Wesley. I washed my hands. I see that you're sitting in a 30-degree angle, approximately in a supine position. Are you having any chest pain at all?
Nope.
Okay, any chest pain at any point? Any shortness of breath, anything?
Nope.
Perfect. Okay, so what I'm going to do now is I'm going to have you kind of tilt your neck back a little bit, and I'm going to have you look to your left. I'm going to inspect, see if there's any jugular venous distension. I'm not seeing any on the right. And I'll have you turn your head. I'm not seeing any on the left either. Okay, so what I'm going to do now is I'm going to, for the purposes of this video, I won't pull his shirt up, but I would inspect approximately 5th intercostal space, mid-clavicular line on the left. See if I could visualize the point of maximal impulse, which would be the left ventricle. So that's what I would be doing right now. So at this point, what we're going to do is I'm going to come back to kind of your chest area in general, and then we're going to measure your chest neck area, measure JVP. So if you kind of want to tilt your head back a little bit more, I do have 2 straight objects right here. Ideally, I would have a ruler. So what I'm going to do is put one vertically at the right sternal angle, and then I'm going to use my other object to kind of go perpendicular and see if I can visualize any of the pulsation that's occurring. And then I'm going to rest it like that until the second straight object rests on the pulsation. And then on the ruler, I would use that to measure it out. And we're looking for 2 or less on that. So then what I'm going to do now is I'm going to kind of feel on each side of his neck individually for carotid pulse, see if I feel any thrills, any whirring, anything that feels abnormal. I'm not feeling that on the right. And then I'm not feeling that on the left either. So now what we're going to do is I'm going to kind of palpate the area that I mentioned originally that I was visually inspecting, your point of maximal impulse on the left. And I am able to palpate this on him. If I wasn't able to, I could have him roll into more of a left lateral position, just because it would bring the heart a little closer to the chest wall, allow for some easier palpation. So now I'm going to palpate, so we did that area. I'm going to palpate your left sternal border. So what I'm going to do is I'm going to be at your midclavicular line here, but then I'm going to feel down for your 3rd and 4th intercostal spaces. And this right here is going to allow me to palpate the intensity of the right ventricle as it's beating. Okay, so we palpated that. We did our point of maximal impulse. So now I'm going to palpate to your interspaces, your second interspaces at the top of your chest, your pulmonic and your aortic. So we'll do your aortic first, second intercostal space, approximately 2 inches below the clavicle. Okay. So now what we're going to do, so regarding the point of maximal impulse, if I wasn't able to actually palpate the point of maximal impulse, I could kind of percuss for cardiac resonance or resonance to kind of determine the silhouette of the heart and more accurately find the left ventricle or the apex, so I could palpate or increase my chances of palpating the point of maximal impulse. So now we're going to move towards our auscultation. So we're going to check for carotid bruits, which would be, once again, the carotids each side simultaneously. I'm going to use the bell for that. And I'll have you hold your breath. Okay, have you take another breath, and then I'll move to the other side. All right, you can breathe again. I'm not detecting any carotid bruits. I'm going to now flip this back to the diaphragm as I proceed with the rest of my auscultation. Okay, so we're going to do left second intercostal space, midclavicular line, the aortic area. Now the pulmonic area on the left. Now I'm going to go approximately, well, 3, 4, and 5, the intercostal spaces at the left sternal border. Okay, now I'm going to auscultate with the bell. And we're going to listen to the apex here, which would be 5th intercostal space, a part of the midclavicular line on the left. And if I wasn't able to auscultate with this, once again, I could have him turn into a left lateral decubitus position, just to bring the heart closer to the chest wall. Okay, and I was able to auscultate the apex. And actually, before I jump back up, I will do the 3rd or the 4th and 5th intercostal spaces as well with the bell. Okay, so now I'm going to have you roll onto your left side the best we can in the video here. And yep, we'll make this work best we can. And I'm going to auscultate your apex again, in the 4th and 5th intercostal spaces on the left. Okay, now I'll have you sit up. So what I would be listening for there, if there's any splitting of S1 or S2. Now what I'm going to do is have you lean forward. And I'll be listening as he exhales if I'm hearing S3 or S4. Okay, going to come back around to the right side. I'm just really quick glancing at, let's see, so this and there. Now we're going to go back to our diaphragm just along our left sternal border, 3 through 4, 3 through 5. So what I'll be listening for is if there were any presence of murmurs, and then I would notate or describe the intensity of the murmur, whether it was a systolic or diastolic murmur. Systolic murmurs can be graded 1 through 6, diastolic 1 through 4 based on their intensity. And then any adventitious sounds that I would hear with that as well. So that is my cardiac assessment. Thank you, Wes.